Hello friends, welcome to my channel. I'm Dr. Himanshu Gupta, and in this video we are going to discuss few important questions in obstetrics. So first I will be discussing you the questions, and in the end we will discuss the answers. So basically this is part 1 of the video. I will post another video of obstetrics. So let us discuss the questions. Derivatives of mesonephric duct are: mesonephric duct is also called as uterus is derived from, Gartner's duct is remnant of, internal genitalia can be differentiated at what time, most common Mullerian anomaly, investigation of choice for Mullerian anomaly, most common incision given in LSCS. Low vertical incision is called as risk of rupture in a classical C-section, risk of rupture due to Kerr's incision. Uterine artery is a branch of, lymphatic drainage of fundus of uterus and ostia of fallopian tube is, ratio of cervix to body of uterus in pre-puberty. Anteversion is the angle between, you have to think the answers friends, in the end we will discuss the answer. Anteflexion is the angle between, length of fallopian tube. Vagina development, upper 1/3, lower 2/3. Vaginal pH in a prepubertal and postmenopausal female. What are the structures derived from the genital tubercle, genital folds, and genital swelling in females and males? Think the answer. You can also pause the video in between. Okay. Gonads are developed from an ovarian fossa relation of the ovarian fossa to posteriorly, laterally, superiorly, and anteriorly. Primordial germ cells are derived from number of oocytes at 5 months, at birth, at puberty, and at ovulation. In oogenesis, the first meiotic division is arrested at which stage, and it is completed at the second meiotic division is arrested at which stage, and it is completed after. Process of spermiogenesis takes place how many days? Conceptus enters the uterine cavity as fertilization of two ova with two sperms in two different menstrual cycles is called as fertilization of two ova with two sperms in the same menstrual cycle is called as short umbilical cord. Most common anomaly with single umbilical artery. Test to differentiate between maternal and fetal blood. Test to differentiate between maternal and fetal RBCs. Uteroplacental circulation is established at what time? Fetal blood flow is established at what time? Estrogen that is specific to pregnancy, E1, E2 or E3. Maximum value of HCG reaches at what time of pregnancy? Intrauterine G-sac can be identified at what value of HCG? Battledore placenta is, velamentous placenta is, placenta bilobata is. Screening for Down syndrome, what are the tests that we use in first trimester? What are the tests that we use in second trimester? Chorionic villus sampling is done at what time? Amniocentesis is done at what time? What is Hagar sign, what is Goodell sign, what is Osiander sign, what is Piscasex sign, what is implantation bleeding. Extra calorie requirement in pregnancy in the first trimester, in the second and third trimester. Total iron requirement in pregnancy is. All clotting factors increase in pregnancy except cardiac output increases by. In respiratory, what happens to TLC, VC, residual volume, expiratory reserve volume. Urine production starts at what time? Breathing starts at what time? Swallowing at what time? Greenish yellow amniotic fluid. Golden yellow amniotic fluid is seen in. Maximum amount of amniotic fluid is seen at what time in pregnancy? Most commonly used test for fetal lung maturity. And what is the best test? Now friends, we will discuss the answers of these questions. So let us begin from the first question. Friends, if you are liking my video, do like my videos and comment. You can also give me suggestions which topics you want me to make videos on. Okay friends, so the derivatives of mesonephric duct are, the mnemonic is SEED. SEED. S stands for seminal vesicles. Seminal vesicles. Ejaculatory duct. Ejaculatory duct. Epididymis. Epididymis. Ductus deferens. Ductus deferens. Uterus is derived from Mullerian duct. Mullerian duct. Mullerian duct is also known as paramesonephric duct. Paramesonephric duct. Paramesonephric duct. Gartner's duct is remnant of caudal part of mesonephric duct. Caudal part of mesonephric duct. Other remnants of mesonephric duct seen in females are epioophoron, paraoophoron, hydatid of Morgagni. Hydatid of Morgagni. Internal genitalia can be differentiated at 12 weeks. External at 11 weeks. Most common Mullerian anomaly is septate Mullerian anomaly. It is also the anomaly that is associated with maximum risk of abortion. Maximum risk of abortion. Second most common Mullerian anomaly is bicornuate uterus. Bicornuate uterus. Investigation of choice in Mullerian anomaly is MRI, and gold standard is laparoscopy. Laparoscopy. Most common incision given in LSCS is Kerr's incision. Kerr's incision. It is low transverse incision. Low transverse incision. Also called as Fennel steel incision. Fennel steel incision. Low vertical incision is known as Crohn's incision. Crohn's incision. What is the risk of rupture of classical scar? It is classical scar is upper vertical incision and risk of rupture is 4 to 9%. In curves it is 0.5 to 2%, 0.5 to 1.5%, and in chronic incision it is 1 to 7%. Uterine artery is a branch of anterior division of internal iliac artery. Friends, what are the branches of posterior division? It is superior gluteal artery, iliolumbar artery, and lateral sacral artery. Remember the other branches of anterior division of internal iliac artery also. Lymphatic drainage of the fundus of uterus is para-aortic lymph nodes, and from the osteofallopian tube it is superficial inguinal lymph node. Also remember that superficial inguinal lymph nodes also drain clitoris and glans penis. Ratio of cervix to body in pre-puberty is 2:1. In post-puberty it is 1:2. In reproductive age group it is 1:3. 1:3. Most common cause of Asherman syndrome is curettage. Friends, I will ask you some questions in between also. Anteversion is the angle between the cervix and vagina. It is usually 90 degree. Friends, in V for anteversion and V for vagina. Anteflexion is the angle between cervix and uterus. Angle is 120 degree. Friends, also remember that uterine artery travels above the ureter. It is remembered by the mnemonic water under the bridge. Bridge is uterine artery and water is ureter. Length of the fallopian tube is 10 centimeter. What are the parts of fallopian tube? They are ampulla, isthmus, and interstitial part, and fimbriae or infundibulum. Okay. So friends, also what is the level of block in C-section? It is T4. And during labor analgesia it is T10. Vagina development, upper 1/3 is from Mullerian ducts, and lower 1/3 is from urogenital sinus. Vaginal pH at prepubertal age group is, and postmenopausal it is 6.5 to 7.5. Vaginal pH is normally acidic due to estrogen. Also remember the vaginal pH in some infections. In bacterial vaginosis, the vaginal pH is more than 4.5, and in candida infection it is less than 4.5. Okay friends, and acidic pH is due to the presence of some bacteria like lactobacillus and Dorderline bacillus. Now we will discuss the derivatives of genital tubercle. In females it is clitoris. Genital folds from labia minora, and in genital swelling from labia majora. In males it forms penis, penile urethra is a derivative of genital folds. Basically genital tubercle forms glans penis, and genital swelling forms scrotum. Gonads are developed from genital ridge, and genital ridge is formed at 5 weeks. Yolk sac is developed at 3 weeks. Oogonia start forming at 9 weeks, and oocytes form at 12 weeks. Ovarian fossa relations are posteriorly it is related to internal iliac artery or vessels and ureter. Laterally it is related to obturator, nerve and vessels. Superiorly it is related to external iliac vessels, and anteriorly it is related to obliterated umbilical artery. Obliterated umbilical artery forms medial umbilical ligament. And what does median umbilical ligament forms? Urachus. And in lateral umbilical ligament it is inferior epigastric vessels. Primordial germ cells are derived from epiblast. Number of oocytes at 5 months of age is 7 million. This is a very important question. At birth it is 2 million. At puberty 4 lakhs. And number of oocytes that undergo ovulation is 400. Oogenesis during first meiotic division, it is arrested at prophase. Basically diplotein stage, and it is completed at 4 hours before ovulation. Exact answer can be at ovulation also. 4 hours before ovulation. And second meiotic division is arrested at metaphase stage, and it is completed after fertilization. Gene responsible for ovary development is WNT4. WNT4. Process of spermiogenesis takes 14 days. In spermiogenesis there is maturity and motility of sperm. The process of capacitation takes place in cervix, and it takes 7 hours. Conceptors enters the uterine cavity at morula stage on day 4, and the stage at which implantation occurs is blastocyst stage. It begins on day 6 and is completed by day 10. Morula is 16 celled stage. 16 celled stage. Fertilization of two ova with two sperms in different menstrual cycles is superfetation. It is not seen in humans. Superfetation. Fertilization of two ova with two sperms in same menstrual cycle is superfecundation, and it can be seen in humans. Short umbilical cord is cord length less than 35 centimeter. Normal umbilical cord length is 30 to 100 centimeter. Length of mature sperm is 55 micrometer. What is the fertilizable lifespan of sperm? It is 72 days, 72 hours. Most common aneuploidy associated with single umbilical artery is Edwards syndrome. It is trisomy 18. Test to differentiate between maternal and fetal blood is Singer's alkali denaturation test. Remember, it is a quantitative test, and 1% NaOH is used. 1% NaOH is used. Test to differentiate between fetal and maternal RBC is Klein-Hoyer-Betke test. And it is a quantitative test. Uteroplacental circulation is established on day 12, and fetal blood flow established on day 21. Estrogen specific to pregnancy is estriol. What is the name for fetal macrophages? Fetal macrophages are known as Hofbauer cells. Maximum value of HCG is seen at 10 weeks, and it is minimum at 16 weeks. And what is the maximum value? It is 1 lakh. HCG doubling time is 48 hours. What is the oxygen saturation in spiral arterioles? Oxygen saturation in spiral arterioles, it is 65 to 75%. 65 to 75%. And intrauterine GSAC can be identified at what value of HCG? It is 2000 international units for transvaginal ultrasound and 6500 for transabdominal ultrasound. Remember, the minimum value at which GSAC can be identified is 1000. Battledore placenta is eccentric attachment of umbilical cord. Filamentous placenta is when the umbilical cord is attached to fetal membranes instead of chorionic plate. When there are placenta bilobata is when there are two lobes of placenta which are equal in size. And placenta subaccentuata is it is two lobes of placenta which are unequal in size. Now we will do the screening for Down syndrome. What is the most common cause of Down syndrome? It is non-disjunction. And what is the risk of recurrence? It is 1%. So in first trimester we do ultrasound. In ultrasound we do nuchal translucency. If it is greater than 3 mm, it is a positive screening test, and serum markers are HCG and PAPPA. HCG increases, PAPPA decreases. When both these tests are combined, it is called dual test, ultrasound plus serum markers. And in second trimester we use nuchal fold thickness greater than 6 mm, nasal bone hypoplasia. Maternal serum markers that we use are HCG increases, AFP decreases, unconjugated estriol decreases. In quadruple test we have all the three markers as above plus inhibin A, which increases. Chorionic villus sampling best time to do is 11 to 13 weeks. And amniocentesis best time is 15 to 20 weeks. Also remember that the screening for Down syndrome is best done between 15 to 20 weeks in second trimester and 11 to 13 weeks in first trimester. What is the percentage of fetal loss in chorionic villus sampling? It is 1%. In amniocentesis it is less than 1%. What is Higar sign? It is softening of cervix, softening of uterus. Higar sign is softening of uterus. What is Goodell sign? It is softening of cervix. And what is Osiander sign? It is lateral vaginal fornix pulsations. What is Jackimer sign? It is bluish discoloration of cervix. bluish discoloration of cervix. What is Pisca sex sign? It is unequal growth of uterus. Unequal growth of uterus. What is implantation bleeding sign known as? It is known as Hartmann sign. Hartmann sign. Hartmann sign. What is Palmer's sign? It is regular rhythmic uterine contractions. Extra calorie requirement in pregnancy is 150 kilocalorie in first trimester and 350 kilocalorie in second trimester. Total iron requirement in pregnancy is 1000 milligram, in which 300 milligram is utilized by fetus. And all clotting factors increase in pregnancy except 11 and 13. 11 and 13. Cardiac output increases by 40% in pregnancy. Plasma volume increases by 40% in pregnancy. RBCs increases by 20% in pregnancy. 20% in pregnancy. And you have to remember that diastolic murmur in pregnancy is always pathological. Diastolic murmur in pregnancy is always pathological. And in respiratory system, the TLC decreases, VLC remains normal, residual volume remains normal, and expiratory reserve volume increases. Expiratory reserve volume increases. And you also remember that maximum increase in cardiac output is seen immediately postpartum. Immediately postpartum. Then second stage of labor. Then second stage of labor. And after that, best answer will be between 28 to 32 weeks. 28 to 32 weeks. Also, there is increase in respiratory system. There is increase in tidal volume and increase in minute ventilation. Minute ventilation. Urine production starts at 12 weeks in pregnancy. Breathing 11 weeks. Swallowing 10 weeks. Glucagon production 8 weeks. Insulin production 12 weeks. Greenish yellow amniotic fluid is seen in post maturity. Golden amniotic fluid is seen in RH incompatibility. Maximum amount of amniotic fluid is seen at 28 weeks and it is 1000 ml. Most common test used for fetal lung maturity is lecithin to sphingomyelin ratio. And best test is phosphatidylglycerol. So thank you friends, hope you enjoyed the video. So meet you in the next video.